dear aspirants, welcome to GDC classes. So you know the exciting news already. So you are ready to take your Gpat stipend who written their exam in the 2023 as well as 2024 and 2025 aspirants they will take in the upcoming months as well as upcoming years. So till now there is many confusions, many doubts in the pharma aspirants across the India. The stipend will come or not. So the clarity is over. So you will get your stipend. The only thing is now onwards focus on your GPAT preparation. So for that only here I came up with one of the important subject in our competitive exams, especially like GPAT, pharmacology. So I am ready to discuss here the previous year MCQs with along with their explanation here. So we will start here with the first MCQ, that is Wilson's disease. Regarding Wilson's disease. So let's have a look on this regarding what is the question here. The question is here, Wilson's disease is a rare inherited disorder due to accumulation in brain, liver as well as other vital organs. So generally Wilson's disease is a copper related chelated disorder, a inherited disorder in which there is excess accumulation of copper in the body parts like brain, eyes as well as liver. So simply the answer is, so the options are like iodine, calcium, iron, copper. Simply the Wilson's disease is a copper chelated disorder. Wilson's disease is a copper chelated disorder. So here it is the copper chelated disorder. So let's have an explanation. It is an autosomal recessive disorder. It is an autosomal recessive disorder. Especially this disorder mainly affect the brain, liver as well as cornea, that is part of eye. So iodine related to the thyroid disorders, nothing but goiter. Calcium involved in bone metabolism disorders like osteoporosis, Paget's disease. Paget's disease means aging of bone, and iron associated with hemochromatosis, a iron overload disorder. So iron overload disorder antidote is desferoxamine. And for Wilson's disease antidote is penicillamine, D-penicillamine. D-penicillamine, a byproduct of penicillin G, a byproduct of penicillin G. And here you are looking our Gpat mantra. So recently launched the Gpat mantra second edition, that is excellently works for you if you are passionately looking for your Gpat exam qualification. So for this all information and everything, first of all subscribe to our GDC English classes for daily updates, pharma jobs, pharma alerts and Gpat, NIPAT, drug inspector, pharmacist coaching. And especially for South India region students, GDC launches their class in the English language. If you are having any doubts, if you are looking for the coaching place, so comment in the comment box. Definitely we will respond from our team. Okay. So this is regarding the first MCQ of our discussion on pharmacology MCQs. Pharmacology MCQs with detailed explanation. So the next question will be the which antibiotic. So which antibiotic undergoes light catalyzed auto-oxidation? Which antibiotic undergoes light catalyzed auto-oxidation? So sugar derived antibiotics, polyene antibiotics, nitrolide antibiotic, beta lactam antibiotics. They undergoes light catalyzed auto-oxidation. So here all these are different category of antibiotics. So simply the answer is polyene antibiotics. The polyene antibiotics are their antifungal in nature like amphotericin B, nystatin, netamycin. So polyene antibiotics undergoes light catalyzed auto-oxidation. So let's have an explanation. You will get more clarity. So here regarding polyene antibiotics undergoes light catalyzed auto-oxidation, degrade in presence of UV light, in presence of oxygen as well as water, in presence of oxygen as well as water. And example like amphotericin B, nystatin as well as netamycin. And the polyenes are undergoes auto-oxidation The amphotericin B reduces its chromophore chain of conjugated. So many number of double bonds are there. Because of many number of double bonds, there is a poly in antibiotics. These are known as poly in antibiotics. And sugar-derived antibiotics, aminoglycoside stable to light, macrolide antibiotics, erythromycin stable to light, beta-lactam antibiotic, penicillin, cephalosporin is also stable towards light. Stable towards the light. Okay. Next MCQs with explanation. So what is the next MCQ here? Let's have a look here. Which of the following is phase 2 metabolism reaction? So acetylation, oxidation, reduction, hydrolysis. So metabolism is takes place in the liver. The drug metabolism, food metabolism, whatever it may be. Regarding pharmacology, we will talk about drug metabolism. So there are phase 1, phase 2 drug metabolism. Phase 1 involves oxidation, reduction, hydrolysis, cyclization, decyclization. So you know the simple answer is acetylation is comes under phase 2 metabolic reaction that takes place in the liver. That's what part of drug metabolism. Part of drug metabolism. Yes, the answer is the acetylation is a phase 2 metabolism. One of the example like isoniazid commonly undergoes acetylation metabolism. Next, here. So types of metabolic reactions like so simply phase 1 metabolic reactions like oxidation, reduction, hydrolysis, cyclization, decyclization and microsomal glucuronide conjugation that is major in case of phase 2 and non-microsomal like glutathione conjugation, acetylation, methylation, sulfate conjugation. So all the previous GPAT questions appear in the 2024 GPAT. 2024 GPAT. Which is the active form of a Ganciclovir. I hope you know about Ganciclovir. So Ganciclovir is a antiviral drug. Ganciclovir is a antiviral drug. Okay. So simply Ganciclovir is generally antiviral drug. So which is the active form? Which is the active form of the Ganciclovir? So triphosphate form, biphosphate form, tetraphosphate, phosphate. So all DNA polymerase inhibitors regarding all DNA polymerase inhibitors regarding the antiviral drugs like Ganciclovir, Acyclovir, Ganciclovir. So all these are converts to active triphosphate forms to show their antiviral action. So here, this is a simple conversion. What happens when these drugs reaches the body, especially enter into the virus infected cells, So simply, Ganciclovir enter into the virus infected cells and the virus kinases like thymidine kinase converts to Ganciclovir monophosphate and Ganciclovir monophosphate invades a host kinase, human enzyme kinase converts to triphosphate form that a triphosphate form inhibit viral DNA synthesis and also inhibit replication in the virus. So GPAT mantra book always available in our app. So it is containing many useful content. With this, definitely you will crack your GPAT easily. Next, H1 receptor protein in human is made up of. Oh, like these questions are rare, but we cannot understand. Nothing more. We cannot expect. Only these questions are coming. This type of questions are coming. So H1 receptor protein in humans is made up of. So receptors are nothing but proteins. So proteins are large molecules. So especially H1 receptor are in humans made up of 359 amino acid 4445 487 390 amino acid. So the answer is so like these questions are very rare. Don't worry. So H1 receptor method the receptors are protein in nature and H1 receptors nothing but histamine receptors are belongs to the G protein coupled receptors. 487 amino acids are present in the H1 receptor protein domain. So whatever it may be. So there are four types of histamine receptors are present in the body. All belongs to the G protein coupled receptor. Especially H1 receptor blockers as an anti-allergic drugs in the common cold enter. And H2 receptor blockers are as an anti-ulcer drugs like ranitidine. And H3, H4 receptors still There more research is required going on. The next MCQ. So regarding the next MCQ, which of the following is the first prodrug for sulfonamide? Which of the following is a first prodrug for the sulfonamide? Sulfatrim, sulfamidochrysotile, trimethoprim, frontacil. So sulfonamides were discovered in the early 1930s. In the Paul Ehrlich era. Paul Ehrlich was known as father of chemotherapy. So frontacil, a prodrug form of the sulfonamides, a first synthetic antimicrobial compounds, first antimicrobial compounds. The answer is simply frontacil. A prodrug gives active sulfonamide that having antibacterial activity. The answer is frontacil. So frontacil introduced in 1935 by scientist Gerard Domack. Frontacil is a prodrug of sulfonamide, converts to sulfanilamide in the body. Sulfanilamide in the body, and all sulfonamides shows their action by inhibiting folic acid synthesis in the bacteria. Inhibits folic acid synthesis in the bacteria. So sulfatrim, combination of sulfamethoxazole trimethoprim. Sulfamidochrysotile, a sulfonamide antibiotic, it is not a prodrug. Trimethoprim, not a prodrug, combined with sulfamethoxazole, that is co-triamoxazole combination. Co-triamoxazole combination. Next. So this is like one anatomy questions. So in the pharmacology you will get pathophysiology as well as anatomy questions, but most percentage, 90% questions will goes to pharmacology, around 10%, less than 10% from anatomy and pathophysiology. The next MCQ is here waiting for you. The appendicular skeleton in adult consists of. So this is a live questions also easily come. So options like 120 bones, 206 bones, 80 bones, 126 bones. So simply there are two things are there: appendicular as well as axial skeleton, and total bones are inclusion of axial as well as appendicular. So like these questions are simple, and definitely you will get a chance to like these questions in the examination. So you can easily answer. Appendicular skeleton 126. Axial skeleton is 80 bones. Axial skeleton is 80 bones. And total is the 206 bones. So this is a simple flow chart of our axial as well as appendicular skeleton, including total number of bones. Total number of bones. So total number of bones are simply like 206. Total number of bones are like 206. So 206 are the total bones. So axial, axis 80. So axis 80. So skull 22, hyoid bone 2, sorry 1, and ear ossicles total 6, 2 ears, 3 plus 3 6, and vertebral column 26 are visible, 33 embryonic stage, and ribs pulpes 24, sternum 1, and again appendicular total 126, limbs 120, girdle 6. Okay, forelimb 60, hind limb 60, pectoral girdle 4, pelvic girdle 2. So this flow chart is very very important. So while if I am giving the gap, so take out the screenshots. Definitely these are very very helpful to you. Total bones are 206, appendicular 126, appendicular. So pronouncing like some long, appendicular 126, axis 80, axis 80, axis nothing but axial skeleton, axial skeleton. So further continuation. Which of the following hormone is not secreted by human placenta? Human chorionic gonadotropin, luteinizing hormone, estrogen, progesterone. So which of the following hormone is not secreted by the human placenta? Human chorionic gonadotropin, luteinizing hormone, estrogen as well as progesterone. So the answer is very simple. So that is a hormone. You can clearly observe luteinizing hormone. HCG will produce, estrogen will produce, progesterone will produce, but not luteinizing hormone. Luteinizing hormone not secreted from the placenta. Not secreted from the placenta. That is luteinizing hormone. Luteinizing hormone. Okay. Okay. The luteinizing hormone is generally from the anterior pituitary gland. Anterior pituitary gland. Okay, so there are many number of hormones are from anti-pituitary gland like growth hormone, echinocorticotropic hormone, thyroid stimulating hormone, gonadotropins, etc. From the posterior pituitary gland, oxytocin as well as vasopressin. Oxytocin as well as the vasopressin. Next, melatonin secreted by. So this is also very easy question. So if like this, you already studied in the anatomy as well as even in the pharmacology also, you will when you gone through the pineal gland. So melatonin is a sleeping hormone, produces somnogenesis, sleeping, somnogenesis, sleeping. And melatonin is secreted by the thyrotropes, adrenal gland, pineal gland, gonadotropins. The answer is very very simple. Melatonin is secreted by the pineal gland, and melatonin released in and the melatonin produces sleep. Melatonin binds to melatonin receptors. Two types of melatonin receptors in the brain, and two types of melatonin receptors are belongs to G protein couple receptors. G protein couple receptor. So melatonin is a sleep producing hormone. Melatonin is a simply sleep producing hormone. It regulates our circadian rhythms, nothing but biological clock, sleeping clock. Biological clock, nothing but a sleeping clock. So the further MCQ is, so what is the next MCQ is here? The next MCQ is, which oral hypoglycemic agent increase levels of incretin hormone by inhibiting the enzyme dipeptidyl peptidase 4. So oral hypoglycemic means they use it in type 2 diabetes. They are type 2 anti-diabetics. So here, which are the following type 2 nothing but oral hypoglycemic increasing the levels of incretins. So incretins are the substance nothing but they increase the insulin release and decrease the glucagon release. Increasing insulin release helps in the reduction in the blood glucose levels. So metformin chemically a bicarbonate, sitagliptin, glipizide is sulfonylurea, thioglitazone A, glitazone binds to PPAR alpha receptors, PPR gamma receptors. So here, sitagliptin, vildagliptin, these are the drugs. They inhibit DPP4, dipeptidyl peptidase 4 enzyme, and increase the incretins. Incretins nothing but they increase the insulin production and they decrease the glucose levels in the blood. They decrease the glucose levels in the blood. So sitagliptin, vildagliptin. So sitagliptin. Sorry for small inconvenience. Kindly accept. Okay, the answer is sitagliptin. Sitagliptin. So these are dipeptidyl peptidase 4 inhibitors. By inhibition of this DPP4 enzyme, they increase the incretin levels. They increase incretin levels. When incretin levels are increases, increase insulin release, decrease glucose output from the liver, decrease gastric emptying, and decrease the appetite. Suppress the appetite. Suppress the appetite. Next, the etiology of jaundice could be hemolytic anemia if. So the reason behind jaundice could be hemolytic anemia. The jaundice may be because of excess breakdown of blood cells. Excess breakdown of blood cells. So the question is simply here. Etiology, the causing of jaundice could be hemolytic anemia, breakdown of blood cells. If unconjugated bilirubin is found more than conjugated bilirubin, increase in IgE levels, IgE which may cause allergic reaction. Conjugated bilirubin is found more than the unconjugated bilirubin. Unconjugated bilirubin is found equal to conjugated bilirubin. So hemolytic anemia. So unwanted breakdown of the hemoglobin leads to decreasing hemoglobin. That leads to anemia, decreased hemoglobin levels. So unconjugated bilirubin found more than the conjugated, unconjugated. And conjugated bilirubin found more than unconjugated. Unconjugated bilirubin is found equal to conjugated bilirubin. So let's have a simply the answer is unconjugated bilirubin is found more than the conjugated bilirubin. More than the conjugated bilirubin. So let's see the explanation for more clarity. So generally, so what is happening here? Pathologically, pathologically, elevated rate of RBC breakdown hemolysis resulting in prehepatic or hemolytic jaundice. Following hemolysis, the liberated components undergoes following breakdown. For example, red blood cells undergoes converts to hemoglobin blood circulation and macrophagocytosis and heme plus globin. So excess breakdown of hemoglobin may lead to jaundice also. That is jaundice due to hemolytic anemia. Jaundice due to hemolytic anemia. Next, murmurs. So next question is, murmurs are generally hard in disorders affecting the following. Murmurs. Murmurs are generally, the MCQs here, murmurs are generally hard in the disorders affecting following. Heart valves, atrioventricular node, pulmonary vein, SA node, that is sinoatrial node. So by seeing the MCQ itself, you know the answer simply. The murmurs are the characteristic features we can hard in the disorder of affecting heart valves. If there is a defect or disorder in the heart valves, there is a murmur sounds will be observed. You can hard murmur sounds. Next, so what are generally murmur sounds? So murmurs nothing but distinct heart sounds arise when valves close during the cardiac cycle. Damaged valves generate abnormal heart sound called murmurs and associated with the heart to valve disorders. Associated with the heart to valve disorders. Common valve related murmurs like mitral regurgitation, aortic stenosis, tricuspid regurgitation, pulmonary stenosis. Stenosis means hardening of arteries. Hardening of arteries. Next, which of the following drug? Which of the following drug is? Which of the following drug is does not require therapeutic drug monitoring? So always a drug requires monitoring. So how much drug is taken into the body? So again, at what time we have to take that drug? So the monitoring should be there, especially some drugs like phenytoin, penicillin G, theophylline, warfarin, they require monitoring. Otherwise, they cause side effects or adverse effects. Monitoring should be required. And here, our question is, which of the following drug does not require therapeutic drug monitoring? Acetaminophen, simply paracetamol, phenytoin, digoxin, zentamicin. So zentamicin is an antibiotic, digoxin drug for CHF treatment, phenytoin and antiepileptic. These are like major drugs used in major applications. So acetaminophen simply that is a small drug. So among these, there is no requirement of therapeutic drug monitoring is for acetaminophen. Acetaminophen does not require therapeutic drug monitoring and remaining all requires therapeutic drug monitoring. If the remaining BCD drugs dose increases, they produce adverse effects. Okay, so so therapeutic drug monitoring should be required in case of aminoglycosides, digitalis, phenytoin, lithium carbonate, anti-manic drug, tricyclic antidepressants, immunomodulators, etc. Immunomodulators, etc. Because the drug should go for monitoring. If not, means they produce severe adverse effects. They produce severe adverse effects. So next question is, our next question is, which hormone stimulates RBC cell production? This is very easy bit. You can easily answer like this questions in your computer examination. So like these easy questions are not high percentage, very low percentage. But mostly the questions always from the basics and definitely always GDC teaches classes in the form of basic as well as concept level. So if you are from the South India region, subscribe to our channel. If you are looking for Gpat, NIPER, Dragon Spectrum, Pharmacist coaching, so contact us immediately. Comment in the comment box. So erythropoietin, prolactin, vasopressin, erythrocytin. Simple answer is the option A, involves in the red blood cell production. Erythropoietin responsible for erythropoiesis. Erythropoietin released from the kidney. Prolactin responsible for lactation breast development. Vasopressin increased blood pressure on blood vessel and retention of urine on the kidney. Antidiuretic hormone. Erythrocytin is not a recognized hormone. Erythrocytin. So erythropoietin produced from the kidney response for erythropoiesis increase red blood cells production. Increases red blood cells production. Next, our next question is: following are the examples of negative feedback system except. Following are the examples of negative feedback system examples: blood glucose maintenance, blood pressure maintenance, blood clotting, body temperature regulation. So all are following are negative feedback mechanism except if glucose levels increase, should decrease. If blood pressure increase, should decrease. If blood clotting is going up, we have to promote because blood clotting occurs during the bleeding conditions and body temperature increases, we have to decrease. So options are so simply by the explanation itself, comparison of options, the answer is simply that is blood clotting. So blood clotting is not an example of negative feedback. Blood clotting should be promoted during the bleeding condition, any injury condition, any injury condition. So this is simply positive feedback mechanism, negative feedback mechanism. So the basic things you know, and even you already studied these things in the your anatomy first semester itself. Blood clotting, not a negative feedback mechanism. Okay, so positive feedback mechanism, milk secretion, blood clotting, fruit ripening, release of oxytocin during labor for promoting the baby delivery, and negative feedback, regulation of body temperature, blood pressure, as well as fluid content. Fluid content. Okay, next. Our next MCQ is which of the following is called as cell-mediated hypersensory reaction? Nothing but a delayed hypersensory reaction, time-taking hypersensory reaction. So if we have knowledge on hypersensory reactions and allergic reaction, the answer is easy. Type 2 hypersensitivity, type 1 hypersensitivity, type 3 hypersensitivity, type 4 hypersensitivity. Type 4 hypersensory reactions, nothing but allergic reactions are cell-mediated. They mediate by T cells and these are delayed reactions. These are delayed reactions. These are delayed reactions. So the simply answer is the type 4 hypersensory reactions are cell mediated. Cell mediated measurement there is involvement of T cells and these are delayed. These are delayed reactions. These reactions take time for observation, for occurrence, for occurrence. So type 1 hypersensory reaction anaphylactic, type 2 cytolytic reaction, type 3 immunological complex or Arthus reaction, type 4 delayed or cell mediated reaction. The cells are nothing but here T cells. Cells are nothing but here T cells. So next MCQ. So what is the next MCQ is waiting for you? Enzyme. The enzyme commonly targeted by drugs to treat hypertension. So which of the following enzyme is commonly targeted by the drugs for treatment of hypertension? Monoamino oxidase inhibit the monoamines and catecholamides, nothing but metabolites. ACE enzyme HMG coreductase cyclooxygenase. Cyclooxygenase targeted by the NSAIDs, most of the NSAIDs. HMG coreductase targeted by the hypolipidemics or anti-hyperlipidemics. And angiotensin converting enzyme is a common target by the drugs to helps in the treatment of hypertension, to control hypertension. So ACE enzyme is a target, major target in the treatment of hypertension. So ACE inhibitors, lisinopril, enalapril, captopril, all are pills. All are pills. Okay. So monoamine oxidase inhibitors generally for treatment of depression and as Parkinson's disease. Next MCQ. Which of the following is so the MCQ is ready for you. So regarding this MCQ, which of the following is not a GABA derivative? Gamma aminobutyric acid derivative. GABA is one of the inhibitory neurotransmitter in the body, especially nervous system, central nervous system. Pregabalin, vigabatrin, gabapentin, rufinamide. So gabapentin, vigabatrin, pregabalin, all these are antiepileptic drugs. They increase the GABA function. Increased GABA function is essential in the epilepsy fits. In the fits epilepsy, there is an excess domination of excitatory neurotransmission. During that, there should be required domination of GABA, a inhibitory neurotransmitter, gamma aminobutyric acid. So the answer with help of option simply we can filter the answer. That is rufinamide, pregabalin. So you can observe simply. So pregabalin, GABA, vigabatrin, GABA, gabapentin, GABA. All these are GABA derivatives, but not a rufinamide. Rufinamide is not a GABA derivative. So what is rufinamide? Simply, it is a triazole derivative. Modulate the sodium channel, reduce the neuronal excitation. Rufinamide also a antiepileptic drug, but not mimic or increase the GABA function or GABA levels or GABA levels. Next MCQ. So regarding the next MCQ, which of the following is peroxisome proliferative activated receptor alpha agonist? PPAR-alpha agonist. So niacin used as a epileptic, hypolipidemic, azitabine, hypolipidemic, cholecalciferol, hypolipidemic, bile acid binding resin, gemfibrozil. So gemfibrozil is an hypolipidemic or anti-hyperlipidemic, which is a agonist at the PPAR-alpha receptor. PPAR-alpha receptors are belongs to the nuclear receptors. Nuclear receptors. Especially PPAR-alpha receptors comes under class 2 or class B nuclear receptors under the examples. So Gemfibrozil is an agonist at PPAR-alpha receptors. So this is a total classification of hypolipidemics, HMG reductase inhibitor statins, bile acid sequestrants, lipoprotein lipase activators, lipolysis and triglyceride synthesis inhibitor, sterol absorption inhibitor. Sterol absorption inhibitor. Next, plasma protein bone drugs. Plasma protein bone drugs. So plasma proteins, there is a albumin, there is a globulin, there is a alpha 1 glycoprotein plasma proteins. Plasma proteins regulates the drug distribution, drug concentration in the blood. If drug is more bound to plasma protein, it having less presence in the blood than plasma. If drug is less bind to plasma protein, it is more concentration in the blood. And if plasma protein bound drug, so for example, this is a plasma protein. Plasma proteins are having large molecular density, large structure. And so this drug will bind. So our drugs binds to plasma protein and drug concentration in the body regulated by plasma proteins. So if a drug bind to plasma protein because of its large molecular structure, this drug bound plasma protein unable to cross the membranes easily. So no pharmacological action, no pharmacokinetic action. So pharmacodynamically inert, pharmacokinetically inert, pharmacodynamically active, pharmacodynamically inert. So drug molecules are having reasonable molecular weight. With this, they can easily cross the biological membranes. But if a drug molecule complex with the plasma protein, that is large molecular weight is unable to cross the membrane. If they are unable to cross the membrane, there is a no movement, no kinetics, there is a no dynamics, no actions. So, if a drug binds to plasma protein, that is pharmacodynamically inert, pharmacokinetically inert. No movement of the drug. If no movement of the drug, not reaching the target. If not reaching the target, no biological end, but pharmacodynamic, no action, no action. So this is the explanation. There are albumin, globulin, alpha-1 acid glycoprotein, lipoproteins, many number of plasma proteins. They involve the drug binding. Next, the short-acting anticholinesterase drug. So anticholinesterase, the name itself indicating they inhibit the acetylcholinesterase enzyme. Acetylcholinesterase enzyme responsible for acetylcholine metabolism. The short-acting anticholinesterase. Neostigmine, Edrophonium, Hypothyroid, Physostigmine. So Edrophonium is a diagnostic agent for the myasthenia gravis. Myasthenia gravis is an autoimmune disease in which our own antibodies from immune system damage our skeletal muscle, become weak the skeletal muscle, make weakness of skeletal muscle, decrease skeletal muscle contractions. Okay. So here, edrophonium used as a diagnostic agent in the myasthenia gravis because of its short duration of action and rapid onset of action. So shows action immediately, but the duration is less. Short duration. Short duration. Edrophonium is simply answer. It is a short acting. It is simply short acting reversible anticholinesterase. And edrophonium is a quaternary ammonium compound. All quaternary ammonium compounds are polar in nature. They are unable to cross the biological membranes easily and unable to cross the blood-brain barrier also. Blood-brain barrier also. So, edrophonium is a short-acting anticholinesterase among from the options. And edrophonium is a drug of choice for diagnosis of myasthenia gravis. Diagnosis of the myasthenia gravis. So, if you want, when I become aside, please take the screenshots of the explanation or you can pass also. Next. Two drugs producing the same clinical effects, safety profile when administered to patient is considered. When the two drugs are having same clinical effects and the same safety profile when administered to patients, they consider as minimum effective concentration, therapeutic equivalent, minimum toxic concentration, therapeutic window. So here there is a equality is there. Their effect as well as their profile, their safety profile. So simply the answer is the equivalency between the safety profile and clinical effect. So this is simply therapeutic equivalent. This is simply the explanation of the therapeutic equivalent. Okay. Next. So match the following antibodies. Sorry. Ma- Sorry for inconvenience. Okay. So the question is match the following antibodies with the correct description. With the correct description. So IgE antibody is nothing but it is mainly responsible for the allergic reaction. And IgG can cross the placenta. IgM, so especially IgA found in the mother milk secretions. And IgM dominant antibody produced in the immune response. So simply PQRS. So P is simply 4. P4. So P4. And P4 option A is there, option C is there. And IgG cross the placenta. So Q1. So Q1 is only C is there. and R2 IgM, so dominant form, and IgA present in the secretion. S is 3 found in the mother's milk. So option C. Option C. P is 4 IgE allergic reactions, and Q1 IgG cross the placenta, IgM2 dominant antibody in the body, and IgA found in the mother secretions, nothing but mother milk. Mother milk. Okay, answer is option C. Answer is option C. So here the detailed information regarding antibodies. So this is very very important. So please go through it by passing the video. Next, progressive loss of bone that occurs in osteoporosis is an example of progressive loss of bone that occurs in the osteoporosis. It is an example of that is an example of hypertrophy, hyperplasia, metaplasia as well as atrophy. Atrophy. So progressive loss of bone that occurs in osteoporosis, hypertrophy, hyperplasia, metaplasia, atrophy. Atrophy means decrease in the growth. Atrophy nothing but a decrease in the growth. This is a basic question you can easily answer. So atrophy decrease in the cell size. Hypertrophy increase in the cell size. So next, the visible colored ring of the eye is known as. So simply, visible colored ring of the eye is known as lens, iris, cornea, retina. So this is also easy question. If you have a simple knowledge on anatomy of eye, that is iris. Iris is a visible colored iris. Iris is a visible colored ring of the eye. So this is the iris. This is the iris. Okay. So let's have a look by passing the video. The structure of the eye. Next, which of the following? Which of the following is a partial fatty acid? Which of the following is a partial fatty acid oxidation inhibitor? Atosiban, oxidation antagonist, nicardipine, felodipine, calcium channel blocker, trimetazidine, verapamil. So trimetazidine is a partial fatty acid oxidation inhibitor, helps in the treatment of anginal disorders. Angina. Trimetazidine inhibit the fatty acid oxidation. Next, outer covering of the testis is known as tunica media, tunica vaginalis, tunica vasculosa, tunica albuginea. So this is directly from the anatomy level question. The simple answer is outer covering of the testis is known as tunica vaginalis. Tunica vaginalis is the outer covering of the testis. Testis is nothing but male reproductive organ. Sarcoma is cancer. Epithelium, plasma cells, connective tissue, glands. So sarcoma is a cancer of. It is simply cancer of the connective tissue. Sarcoma is a type of cancer. It will attack mainly connective tissue. So here it is an important carcinoma, sarcoma, leukemia, lymphoma, myeloma, central nervous system cancers. So for the Gpat, for success in Gpat, your number of MCQs practicing sessions is very very important. So you will become more accuracy in the giving answers, and definitely you will go to the top rank in your Gpat examination. The phase in which two identical copies of DNA are formed. The phase in which two identical copies of DNA are formed. Generally, DNA synthesis takes place in the S phase. And here question is the phase in which two identical copies of DNA are formed. That is simply the answer is the two identical copies, nothing but DNA synthesis takes place in the S phase. S phase. So this is simply what is G phase, S phase, G2 phase, M phase, G0. G0 resting phase, there is no cell division, but in the cancer cells there is a cell division. M phase, mitotic phase, cell division phase. G2 phase, pre-mitotic. S phase, synthesis, that is DNA synthesis. G1, pre-synthetic phase. The G1 is a preparatory phase of S phase. In the S phase, there is a DNA synthesis. Renin is released from juxtaglomerular cells, microglial cells, beta cells of the pancreas, hepatocytes of the liver. So this is also easy bit. You can answer easily. The renin released from the juxtaglomerular cells of the kidney. Juxtaglomerular cells of the kidney. Next. The further MCQ is which of the following cranial nerve is instrumental in motor function? Motor function. Vestibulocochlear, optic, axillary, olfactory. Which of the following is a cranial nerve is instrumental in the motor function? That is axillary, axillary. So this is very important table for you. With the tricks you can remember easily all names of the cranial nerves along with it is a sensory or motor or both as well as along with their functions. So make the screenshot of this slide. Definitely if you got a question you can easily answer in your competitive exams. It will help you to get a good rank or top rank in your examination. Next, leprosy is a so here also one of these questions. Viral disease, metazoal disease, fungal disease, bacterial disease. Leprosy caused by Mycobacterium leprae. Mycobacterium leprae is an acid fast type bacterium. Acid fast type bacterium. It is also comes under bacteria, but it is an acid fast bacterium. Undergoes acid fast staining for identification, differentiation. So leprosy also known as Hansen's disease because of scientist name Hansen. Next, salivary amylase helps in the digestion of which of the following nutrients? Salivary amylase, simply fats, vitamins, proteins, starch. Starch is nothing but carbohydrate. Carbohydrate nothing but amylase. Salivary amylase. Saliva containing a salivary amylase that starts carbohydrate digestion from the mouth itself. Answer is a starch. Starch is a carbohydrate. Carbohydrates are digested by salivary amylase from the saliva in the mouth. Next. The most common neoplasm in patient with AIDS is acute myeloid leukemia, adenocarcinoma, Kaposi sarcoma, carcinoma of Kaposi sarcoma. The most common form of type of cancer occurred in AIDS patient is the answer is simply Kaposi sarcoma, where there is a loss of immunity in the patient and loss of weight also observed, loss of muscle mass also observed. Kaposi sarcoma mainly occurred in the AIDS patients. Mainly occurred in the AIDS patients. Next, Coombs test. So Coombs test is used for detection of Coombs, brucellosis, typhoid, anti-globulin, yellow fever, syphilis. So Coombs test is a specific test for detection of Coombs. Coombs nothing but a comb. So that is anti-globulin. Coombs test for detection of anti-globulin. And Coombs test is for brucellosis. Here there is no option, not an option. Brucellosis. Brucellosis. Coombs test is identification of anti-globulin, nothing but also brucellosis. Next, fluoroquinolones are synthetic antimicrobial compounds with less resistance. With less resistance. So fluoroquinolone shows their action by fluoroquinolones are the drugs shows their action by inhibiting DNA synthesis and fluoroquinolones are bactericidal in nature. Inhibit folic acid synthesis, no. Inhibit ribosomal substitution of protein, not a protein synthesis inhibitors. Disrupting peptidoglycan, no effect on peptidoglycan. So inhibiting the DNA garage and topaz causing supercoiling and fragmentation of bacteria. So fluoroquinolones are synthetic antibacterial compounds with less resistance, with excellent mechanism of action, and they mainly inhibit the DNA synthesis in the both gram-positive gram-negative bacteria, and these are bactericidal in nature, kills the bacteria by inhibiting DNA synthesis, especially inhibit DNA topoisomerase 2 as well as topoisomerase 4 enzymes. Topoisomerase 4 enzymes. So inhibit topoisomerase 2 in gram-negative bacteria, topoisomerase 4 in gram-positive bacteria. Fluoroquinolones are DNA synthesis inhibitor. They are known as bactericidal drugs. Inhibit the DNA synthesis. Next. What is the proposed mechanism of action of artemisinin in the treatment of malaria? So blocking of the Plasmodium falciparum ATPase, disrupting ion homeostasis, inhibition of heme polymerase enzyme causing accumulation of toxic heme, inhibition of dihydrofolate reductase interferes with folic acid synthesis, generation of reactive oxygen superradicals, especially artemisinin contains a endoperoxide ring in its structure. Endoperoxide ring in its structure. That because of that endoperoxide ring in its structure, that generate a reactive oxygen superradicals. That reactive oxygen superradicals damage the plasmodium, that is malarial plasmodium, malarial parasite. The answer is simply generation of reactive oxygen superradicals. So as I mentioned here, so it contains a endoperoxide ring. That endoperoxide ring generates a free radicals. That free radicals damage the plasmodium. So artemisinin is natural alkaloid available in the Chinese mainly. Which of the following is not a? Which of the following is? Which of the following is not a class 1C antiarrhythmic? Propafenone, mexilatin, morphine, flecainide, flecainide, uncanide. So propafenone, mexilatin, morphine. So which of the following is not a class 1C antiarrhythmic? Simply that is mexilatin. Propafenone, morphine, flecainide are class 1C antiarrhythmics, but not mexilatin. Mexilatin is class 1. So mexilatin is here class 1B. So this is a simple classification of antiarrhythmic drugs. You can remember, save this slide. So remember the classification easily. Remember the classification easily. Next, the amount of air. So the amount of air moves in or out of the lungs for each respiratory cycle. For each respiratory cycle, the amount of air coming into the lungs and going out of the lungs is known as expiratory reserve volume, tidal volume, inspiratory reserve volume, residual volume. So both inspiratory as well as expiratory volume is a tidal volume. The answer is simply tidal volume. Tidal volume is simply, what is the tidal volume? Volume of air inspired or expired with every normal breath without any effort. So the amount of tidal volume is 500 ml, zero point 0.5 liter, 0.5 liter. The cranial nerve that regulate heartbeat. Very good. So cranial nerve that regulate heartbeat, option 7, 9, 10, 8. So 10 is a cranial nerve, vagus nerve. Vagus nerve when stimulated it releases acetylcholine. The acetylcholine on heart causes relaxation. Acetylcholine on heart causes relaxation. So cranial nerve 10 is the answer that regulates heartbeat by releasing acetylcholine. By releasing acetylcholine. That's why acetylcholine, also known as vagus nerve. The other name of acetylcholine is vagus nerve. It is releases when vagus nerve is stimulated. The 10th cranial nerve, vagus nerve is nothing but 10th cranial nerve that causes relaxation of heart, regulation of heartbeat, regulates the heart. The next MCQ is, which one of the following enzyme comprises a major part of enzyme-linked receptor? So enzyme-linked receptors, also known as catalytic receptor, they known as enzyme-linked receptors because of receptors are interacting with enzymes for their action. So receptor is serine phosphatase, receptor tyrosine kinase, receptor histidine kinase, receptor threonine phosphatase. So here enzyme-linked receptor, there is involvement of enzyme, and more than 90% there is involvement of tyrosine kinase enzyme. That's why enzyme-linked receptors, also known as tyrosine kinase receptors. Enzyme-linked receptors, also known as tyrosine kinase receptors. Tyrosine kinase receptor. Receptor tyrosine kinase. Okay. So especially one of the common hormone in the body, that is insulin, a peptide hormone, acts to the enzyme-linked receptors. Acts to the enzyme-linked receptor. Apart from insulin, mainly there is a growth factors like epidermal growth factor, vascular endothelial growth factor, some other growth factors. They shows their action to enzyme-linked receptors. They shows action to the enzyme-linked receptors. Enzyme-linked receptors. So this is simply our session on the previous year Gpat MCQs from the pharmacology subjects. So like this interesting thing, and if you are looking for success in the competitive GPAT Sniper Pharmacist Drug Inspector, so come and join with us. GDCs always will help you to achieve your goal. The quality and content is the weapon of GDC. So GDC having many number of things. For each course, you will have a pre-recorded lectures, you will have a total syllabus covering lectures daily evening and a MCQ session with explanation, YouTube live sessions, motivation session, practice in MCQ test, daily test, weekly test also there. And even the excellent materials are there in the GDC. So GDC materials are well known throughout the India. So GDC GPAT Distance Center is number one pharma platform for pharma aspirants, and especially GDC launches English classes for South India students. So I am the coordinator, myself Ashok Kumar Apoli. So if you having anything to connect, if you want to connect with GDC, so comment in the comment box, we will respond. So all the best. Thank you. Subscribe to GDC English classes.